It can be used in many, many different ways. It can be used for people who don't have any obvious clinical problems, because there's always place for improvement or expansion. So then it's a very, very powerful tool if it's properly used with the proper set and setting for medical, psychiatric problems that cannot be really handled otherwise. We don't have really very effective tools in psychiatry. You know, in psychiatry mostly these days it's symptomatic suppression, which is called therapy. Now, in medicine, you would use symptomatic treatment only in two situations. One is if you simultaneously do something that goes to the causes of the problem, and you still want to give some relief of the symptoms, then you combine it with symptomatic treatment, or you use symptomatic treatment if these are incurable diseases, if you don't know what to do more effectively. So what we are doing is trying to find out more and more effective ways of suppressing symptoms without asking the question why the symptoms are what they mean. So it's really treating all these emotional problems as if they were incurable, which is not true. I mean, if you have the right kind of model and right kind of tools, I mean, you can really reach the roots, and you can actually change that condition. Now the problem is that's not very interesting for pharmaceutical companies. You know, pharmaceutical companies need something like Librium or Valium that you have to take 4 times a day for the next 20 years, not something that you would do once a month, and it could actually change things, you know. And the pharmaceutical industry needs something that helps a little, you know, not too much. Then, you know, there are other things I think extremely interesting, the impact on art. Like when we started using psychedelics in Prague, we had many artists who came, and I couldn't go back for 20 years. And when I came back and went to some of the exhibitions of these artists, you could see, I mean, exactly where they took the LSD. I mean, there was a jump, you know, in their artistic expression. I mean, the freedom that they had and how they handled colors and everything. So that's another possibility. The very significant thing is also the spiritual dimension. You know, we have organized religions where you go to church and they tell you about experiences that people had 2,000 years ago. But if somebody would have a really full-blown spiritual experience in a church today, your average minister would probably call a psychiatrist and the ambulance. They would think that this kind of thing doesn't belong to the church. I don't know if you saw the movie Brother, Sun, Sister, Moon, when Francis of Assisi has the experience in church and, you know, takes off his clothes and then starts giving the rugs away. So, you know, the spiritual experiences can be, at least for the time of their duration, can be pretty wild. But it is ultimately something that can give you this spiritual knowledge rather than sort of try to cultivate some belief of a particular creed. And what's more important, that it will make it possible for you to choose the spiritual path that is right for you. It doesn't, you know, doesn't necessarily. It's not necessarily so that this one way of worshiping is or should be good for everybody. You know. And I think the most interesting way of using psychedelics responsibly would be to actually influence the planetary crisis. That people who have done this work responsibly, they almost change into another species. You know, for them, like, violence is not an acceptable way of solving problems anymore, or it's absolutely unacceptable to destroy nature, to destroy water and air and the soil that's nourishing us. We're biological creatures, so there's no higher imperative than protecting life, creating an environment that protects life. No political, military, ideological reasons or profit, are good enough to override this kind of priority that we should have. And people know that. They have experiences of how deeply we are connected with nature, how we are embedded in nature. And there is a sense of planetary citizenship that comes before being an American or a Czech or a German or whatever. We have a certain common interest here, which is the condition of the planet, so that it can support life. So that should be priorities. People, you don't have to teach people ecology. You don't have to teach them international peace. I mean, when they, to the extent to which they can clear their own traumatic past, they just automatically develop in that direction. I mean, I'm not. I don't want to be an advocate for psychedelics. I'm talking about holotropic states in general. I mean, it can be spiritual practice. It can be, holotropic breathwork. It can be some kind of rituals of native cultures. But some form of these holotropic states that can really change people and under the right circumstances, they're changed in the right direction, I would say. But I would certainly nationalize insurance companies, and I would nationalize pharmaceutical companies. I mean, people should not be making money on somebody's, suffering. And what they are doing, I think, is just horrendous. Yeah. You have, when they change the patented medicine to generic, it goes to fraction of the cost, and they're still making quite a bit of money. So can you imagine what they are making? They know people where the major part of their income goes to medicines.